Hey guys, we're back. We're finishing our late afternoon procedure where we did a neck lipo and face type procedure to tighten, and now we're finishing it with Fractora. This is a deep microneedling radiofrequency treatment. You can see how deep it is because there's little blood skin. Those little blood splots are because of going, a nice depth into the skin. When you go past the papillary dermis, you're going to see a little speckling of blood, so we're getting nice deep tissue contraction. The reason we like this, now this is a younger patient, so it's not a necessity, but he wants textural improvements of his skin. If you have acne scarrings, it will improve it. If you have any irregular texture, large pores, or fine crepey skin, this will also improve it. This is great after lipo to get the neck skin to tighten up a little bit more from the top down rather than from underneath up. And also if you have crepey skin, it's very valuable. So we're doing a really deep setting here with double pass because we know that we get a better result that way. And we just needle this all across, but I want to introduce Danielle, our newest member of our team, physician assistant, who is an expert in the Fractora treatment, and she's doing this today. And she just wants to tell you guys a little bit about the procedure. Tell them what Fractora is and why we do it.
So Fractora, like Dr. Emer said, is radiofrequency microneedling. It goes down to a depth of 3,000 microns, so it is deeper than most microneedling treatments would hit. And what it does is it targets the contraction that occurs in the deep part of the dermis as opposed to just that superficial area that we typically hit. This in combination with other therapies is great. Dr. Emer was mentioning post-face tie or even just as maintenance by itself. And the outcomes of it are very visible rapidly, so it's great short-term and long-term.
And the thing is, because it's going about 3,000 microns and 3 millimeters in depth, you can layer other lasers on top. And one of our favorite treatments right now is the Fractora Clear and Brilliant combo, because there's not much downtime and you're getting both tightening and the fine pores. If you have deep acne, so you can do Fractora plus CO2 or Rejuvenation treatment. We're just doing these amazing combinations. So my opinion is, whatever you do, you Fractora it. Just hashtag Fractora it. You just do it on top of you just do it right before you do anything else on top. No one really needs anything deeper than 4 millimeters in depth, so you're really going the depth you need. And the average person for skin tightening and kind of textural improvement only really needs about 1 millimeter to 1.5 millimeters. So at a 3 millimeter depth, you're really well taken care of. And so yeah, I mean, you're doing really nice, steady pulses with overlap. We're doing double pulses. You keep the skin contracted right against the tips, and you just make sure that each area is treated. And this can be done as early as every 2 to 4 weeks if you really wanted to, but in general, every 4 to 6 weeks is typically what we would recommend for those with wanting more skin tightening, for those wanting more acne scar improvement. What do we got going on in social over there, Adele?
Obviously, the patient's sedated.
Yeah, so he is because we're in a procedure and we're doing, we just did his neck lipo and neck tight. But in the office, we can do nerve blocks, we can do numbing medicine, we can do numbing cream as well as ice packs.
What's the difference between this and microneedling RF?
Well, this is a microneedling RF. This is just one of the deepest microneedling RFs. Keep a good overlap. It's nice when they're asleep because we can go a little more overlap and a little more pulses. Is there anything for people to be aware of with Fractora, or can anyone get this treatment?
Anyone can get this treatment. It's very safe for all skin tones. There are 2 different types of tips, coated and uncoated.
So how would we determine which one we would use?
So coated would be good for any darker skin tone or someone who has a higher risk of hyperpigmentation with any heat-based therapy. Anybody has the potential to create dark spots after a treatment or just in general. And having a coated tip which spares the surface from getting energy essentially rules out any risk. And especially when you combine that with good skincare and good prep for the laser, you eliminate high risk of PIH.
Yep, that's true. So in general, energy-based treatments can increase post-inflammatory hyperpigmentation or pigmentation, but also melasma. So in general, what we try and do is decrease that risk by pre-treating the skin with lightening creams and using, in this case, in darker skin types, coated tips. But for him, being a lighter skin type, we're able to really go hard with the uncoated tips, very deep, nice energy. We're going to continue that along his neck and finish up the treatment. But microneedling RF is the hottest energy-based treatments right now because it can be combined with other things. It can be used on dark skin types. It treats a lot of different factors such as aging, laxity of the skin and wrinkles, as well as acne scars. And it's very, very low downtime. Any other questions on there?
No.
All right, well, we're going to finish up the surgery, and you'll see how our patient's doing tomorrow when he does a live in the morning. Take care, guys.